Today's presentation will be on birth control, the group project for Bio 233. The participants in the group names are following: Devasia, Bethany, Jessica, Brianna, Victoria, and Lorena. According to the Centers for Disease Control and Prevention, CDC, birth control is defined as the use of any drug, surgical procedure, device, agent, or sexual practices to prevent conception or pregnancy. Birth control methods function differently. While some may prevent the sperm from getting to the egg, others work to prevent the ovaries from releasing the egg to be fertilized. On the flip side, birth control can also take a permanent form through surgical procedures. The choice of any method of birth control is predetermined by various factors, including the individual's health, the number of sexual partners, one's future desire to give birth, and the frequency of sexual activity.
We took the interest in the topic of birth control because it's important to know what effects birth control can have on our bodies. Birth control has different effects for all women, and it's important to know what goes inside our bodies. Knowing what effects birth control has on a person's body, whether male or female, everyone should be educated on the different various methods of birth control and the pros and cons of the many different variations that people can choose from. Although most women use birth control to prevent pregnancy, there are also other reasons that someone can use birth control, such as using birth control to avoid painful periods and preventing heavy and irregular periods. Although there are many different types of birth control, people should have knowledge on the different effects that comes with the different methods of birth control and which one works well for their body. Some methods are more effective than others, and it just depends on the person and what type of birth control they want to put inside their bodies and what reason they're using it for.
Birth control comes in many shapes, forms, and sizes. There's an array of options when it comes to choosing which birth control is best fit for a woman or man, like the following: temporary, surgical/reversible, permanent, and abstinence. Some examples of temporary birth control are pills, patches, shots, vaginal rings, and IUDs, just to name a few. Examples of surgical/reversible birth control methods include intrauterine contraception, hormonal methods, barrier methods, fertility awareness methods, lactational amenorrhea method, and emergency contraception. Permanent birth control methods include female sterilization through tubal ligation and male sterilization, commonly called a vasectomy. Vasectomies and tubal ligations, they can both be reversed, but the chances of conceiving a child after reversing are low, especially the longer it's been. These contraceptives prevent a woman from getting pregnant, and their effectiveness ranges from taking a daily dose to lasting up to 10 years.
Of course, just like with anything, there are always pros and cons. Some of the upsides to taking birth control would include reduced bleeding and cramping during periods and ovulation, which reduces anemia. Some women could also experience fewer or no periods at all. There's a reduced risk of pelvic inflammatory disease and ectopic pregnancies and symptoms of endometriosis. There's a reduced risk of acne and ovarian cysts. And of course, most methods of birth control are more than 99% effective in preventing pregnancy if they are used properly. Some of the downsides of taking birth control include weight gain, blood clots, hot flashes, bone pain, swelling of the ankles and feet, unusual changes in vaginal bleeding. There's yellowing of the eyes and skin, seizures, liver problems, depression, mood changes, breast cancer and cervical cancer, osteoporosis, which is porous bones, rectal bleeding, alopecia, nausea, vomiting, dizziness, ectopic pregnancies. There's a higher risk of heart attacks and strokes. There's gastrointestinal disorders, and of course, birth control does not prevent against HIV and STDs. This is just a short list of some of the possible side effects birth control could have on you.
There are two main controversies of birth control, one being religion and the other being the side effects that it has on women. Today, the Catholic Church is the only Christian denomination that adheres to a historical standard on birth control or contraception. The Catholic Church believes that any form of contraception is against their religion because it is not a natural form of protection. But women aren't only using contraceptives to prevent pregnancy. Some women utilize birth control to help regulate their period, cramps, PMS, anemia, and to relieve endometriosis symptoms. On the other hand, even though they may not want to take birth control to help with these things, the long list of side effects for some women outweigh the pros. The list includes headaches, nausea, sore breasts, spotting, weight gain, mood changes, and vaginal discharge. Higher risk side effects include blood clots and high blood pressure or hypertension, which can lead to a heart attack or stroke.
As we know, birth control is a controversial topic leading to many different things. One of the outcomes we receive as society is more women becoming successful by graduating and pursuing a career. Many women who become pregnant while going to school often end up having to drop out because of their mental health and financial stability. Nobody is ever truly ready to start a family and have kids, but a young girl studying is much less ready than anybody else. And regardless of different beliefs, getting on contraceptives is becoming more normalized and common. This leads to less unplanned pregnancies and less children growing up in poor living conditions or even foster homes from those women who have to give up their child. Women also push on men being able to have more effective birth control options, since it is not fair for females to be suffering all of these negative side effects from it, and even putting their life at risk to receiving deadly blood clots or even breast cancer or cervical cancer.
In conclusion, birth control methods work differently. While barrier methods such as condoms work immediately, others such as hormonal methods take time to start working. However, it is essential to know that no form of birth control is 100% effective. As such, one can still get pregnant while using them. When used correctly, birth control can be 99% effective in preventing pregnancy. Stay safe.